Hey, so today I'm going to be talking about Dracunculiasis, also known as the guinea worm disease, and just want to warn you that some images in this presentation may be disturbing. So, the infectious agent of Dracunculiasis is going to be D. metanensis, also known as the guinea worm, and throughout this presentation I'm generally going to refer to the disease itself as Dracunculiasis and to the infectious agent as the guinea worm. Taxonomy. So, important things to note about the taxonomy are that the guinea worm is a member of the kingdom Animalia, so it's not a bacteria, it's not a virus, it's a parasitic nematode of the genus Dracunculus. Other notable species in the genus Dracunculus include D. insignis and D. lucha, which are going to infect primarily dogs and otters respectively, and they're only found in North America. They can't infect humans. Now, there aren't really any strains of the guinea worm. However, in the 1980s, there were two individual cases, unrelated, in Pakistan, in which red guinea worms were found. And it was determined that the red pigmentation was not due to the host's blood, but not much else was discovered. So all members of the genus Dracunculus are going to have this similar life cycle, where L1 larvae are going to exist in a body of water. They're going to be picked up by copepods, which are very small crustaceans. In the copepods, the L1 larvae are going to develop into L3 larvae, and that's possible for frogs or fish to act as paratenocosts and to eat the larvae and then themselves become infected, and then for a definitive host to eat the infected frogs or fish. However, generally the definitive host, such as a dog, or in the case of the guinea worm, a human, is going to ingest water contaminated with infected copepods. Once the larva gets into the host's stomach, it's going to puncture through the stomach wall and migrate to the thoracic or retroperitosteal cavities. Once there, the worms are going to molt a few more times. The male and female worms will mate, and the female worm is essentially just a larva-producing factory at that point. So it's going to develop, its uterus is going to expand, its gut tube is going to actually flatten so it can make more room for the uterus. Then after 10 to 14 months, in the case of the guinea worm, the worm is going to migrate to subcutaneous tissue. It's going to release some uterine fluid to cause a localized inflammatory response. A dermal lesion and then a blister will occur, and then once it ruptures and the worm comes in contact with the body of water, it's going to release hundreds of thousands of larvae, and this whole cycle is going to repeat. So the first recorded case of Dracunculiasis was found on an Egyptian scroll dating back to the 15th century, and there was also actually a mummy that was exhumed in which they found a specimen of a guinea worm, so that's actually kind of cool. In Persia and Israel, there were also recordings of the symptoms of Dracunculiasis dating back to the 11th century AD, but it wasn't until 1875 that Alexei Fedchenko discovered this life cycle, where the guinea worm uses an intermediate host and then possibly a paratenic host, but really the definitive host is a mammal. Then in the early 1980s, the CDC and the WHO got together and decided that it would be a great idea to completely eradicate the guinea worm. And then in 1986, the Carter Foundation joined in on this initiative and really spearheaded the efforts. So in the early 1980s, there were 3.5 million initial cases. And as you can see, cases drastically decreased from there until in 2018, there were only 28 cases. And as of the 12th of December 2021, there have only been 10 human cases across Angola, Chad, Ethiopia, Mali, and South Sudan. There was one case in Cameroon. However, it was discovered that the individual was infected in one of these other countries, and then during the 10 to 14 month incubation period, they traveled to Cameroon, and so the worm emerged while they were in Cameroon. The next the next step in this process of eradicating the guinea worm is to prevent dogs from being infected, because as I mentioned previously, dogs are a definitive host. They can facilitate this life cycle, and so preventing more dog infections is really going to help in the process of eradicating Dracunculiasis. So we're on to characteristics of the guinea worm specifically. So as you can see, this life cycle is pretty similar to that of other members of the genus Dracunculus. However, since the guinea worm can infect human hosts, it interacts with human physiology. So once a human generally drinks contaminated water that's filled with infected copepods, and the larvae get into the host's stomach, they're going to puncture the stomach lining and migrate either to the retroperitosteal cavity, the thoracic cavity, or intramuscular fasciae, or subcutaneous tissue, where they're going to molt a few more times, they're going to reproduce, and the fertilized female worm, after 10 to 14 months, is going to migrate to more superficial subcutaneous tissue. Generally, emerges from the lower limbs in about 90% of cases. However, it can emerge from the thighs, the arms, the chest, even the neck. There was one case of an individual who was infected with 20 worms, and so they were emerging from all over the individual's body. So the process of the worm emerging involves localized inflammation. You're going to get a dermal lesion that's going to develop into a sizable blister over the next several days, and it's going to rupture, and then larvae are going to be released once the wound comes in contact with water. And if you have a microscope, you can actually see the hundreds of thousands of larvae being expelled from the female worm during that process. So symptoms, there are going to be acute symptoms. This is when the worm is actually emerging. I can see from this picture, it looks like there are 2 worms emerging from this blister and 1 from this. So the acute symptoms are going to be flu-like in nature, so you might get muscle aches, lightheadedness, light fever, and then there's also going to be a local agony. A dermal lesion develops into a blister, and then parasitic emergence, where you can actually see the worm emerging from the person's skin. And then there are going to be chronic symptoms, and when I say chronic, I mean with reference to that 10 to 14 month incubation period. So that's primarily going to include immune suppression. So when the larva punctures the stomach wall of a human, it's going to release chemicals that are going to drastically decrease the level of antigen-specific T cells and drastically increase the level of T regulatory cells. That's going to really decrease the inflammatory response within the body. So individuals with arthritis, their symptoms of arthritis can actually be lessened after they get a parasitic guinea worm infection. However, if the guinea worm emerges around the joint, it can cause very severe inflammation, which can result in locked joints. So the joint and the limb become incapacitated, and that occurs in about 0.3% of cases. The mortality rate is arguably less than 0.1%, but in 0.3% of cases, an individual develops a secondary infection because of this open wound. It may not be correctly cleaned. And then, fun fact, so because parasitic nematodes such as the guinea worm cause this anti-inflammatory response, some researchers have looked into using parasitic nematodes as a cure for illnesses involving inflammation, such as asthma or inflammatory bowel syndrome. And so in 2007, I believe, there was a case in which researchers injected 50 hookworm larvae into an individual's skin, waited a few weeks, and then gave the individual ivermectin or mebendazole to kill the larva, or the larva. And it actually helped decrease the severity of their asthma symptoms. So that's a little fun fact. So diagnosis. So if someone has these acute symptoms, that's generally a good indicator that they have dracunculiasis. However, during that 10 to 14 month incubation period, there aren't really any visible signs that the person may be infected. So one would have to use an antibody test, perhaps using the Western blot setup, and they would really be looking for elevated levels of IG4 and IG1, or else elevated levels of IgE antibodies. It's really either one or the other. And then since the fertilized female pregnant worm can grow up to 1 meter in length, it's sometimes visible beneath the skin as like a raised welt almost, and MRI tests or other imaging tests are sometimes able to see it. So there aren't really any treatments for dracunculiasis. The only thing an individual can do can increase the rate at which the worm emerges. So you can see over here they tied the guinea worm to a matchstick, and they're going to gradually remove it from the person over several weeks to months. And the reason why you have to very slowly remove it is, one, it's agonizing, and the other is that the worm can be wrapped around intramuscular fasciae, tendons, or even bones, and so removing it too quickly can damage those underlying tissues, or else the worm can sometimes break off inside the person. That can cause very severe inflammation. So analgesics may be used to help with the pain, but the main two factors are going to be cleanliness. So you can see this exposed ulcer, so making sure that it's clean so that secondary infections don't occur, and then support for the individual. One research study I found discovered that it takes approximately 12.7 weeks for an individual to recover from dracunculiasis. So that's 12.7 weeks in which they are incapacitated, and so having a supporting community to help them through that process is really integral. So as far as surgery goes, because the worm may be wrapped around underlying tissue, and clean surgical utensils may not be readily available, surgery is generally not, it's generally more harmful than it is beneficial. And then, so there are some antihelmintics which work against other nematode infections, such as ivermectin or mebendazole. However, they don't have much of an effect on the guinea worm specifically. So, future outlooks. As I mentioned previously, there were only 10 human cases in 2021. However, between 2018 and 2019, there were 3,000 dog cases, so that was really facilitating the life cycle of the guinea worm. So the main preventative measures are sterilizing water using Temifos, which kills the copepods but allows the water to still be safely drank, and then setting up barriers so infected dogs cannot go into bodies of drinking water, and then educating the populace on the worm and what to look out for, and what to look out for in diseased dogs as well. So thank you for watching my talk. These are the images I used, and these are the sources. I hope you have a great day. Bye.